Hello everyone, I am Dr. Shabarinath Samudrala. I am a consultant interventional cardiologist associated with Yashoda Hospital, Malakpet. Today I am going to tell you a few tips on how to prevent coronary artery disease. As we all know, coronary artery disease is a leading killer in the cardiovascular diseases which can result in myocardial infarction. It can also result in heart failure. It can also result in cerebrovascular accident. So how do you prevent coronary artery disease? So we have few modifiable risk factors and we have few non-modifiable risk factors. Among the non-modifiable risk factors, one is age. That is, as the age increases, there is increased risk of coronary artery disease. Gender, if you see, male population are a bit more prone to coronary artery disease when compared to female. Female population till the age of menopause, they are protected with a few hormones naturally produced by females. Whereas after the age of menopause, both male and female have the same risk of coronary artery disease. Then if you see the modifiable risk factors which we routinely see and which can be adequately controlled so that which can prevent the coronary artery disease, which includes hypertension, diabetes, dyslipidemia and lifestyle modification. So first, coming to the lifestyle modification, how do you manage lifestyle to prevent coronary artery disease? So first thing is avoid sedentary lifestyle, which can be done by encouraging a healthy lifestyle in the form of walking regularly, particularly brisk walking or cycling or jogging, at least 45 minutes per day or 5 days a week. Then avoid high carbohydrate diet or encourage good quantity of proteins and equal compositions of carbohydrates and fat in the diet. Then avoid bakery products, particularly in the form of which are made of maida, like pastries, white bread. Then you can encourage fresh fruits and vegetables. Any amount of fresh fruits or vegetables can be encouraged in diet. Particularly you can consume boiled veggies. Then coming to the smoking, it increases the atherosclerosis risk. It lowers the HDL cholesterol levels, thereby accelerates the atherosclerosis. Therefore, reduce the smoking. From next day itself, the atherosclerosis comes down and you can have a healthy lifestyle. Smoking particularly increases the risk of atherosclerosis by 10 times when compared to normal population. Control blood pressure adequately. Keep regularly visiting your physician or a cardiologist to maintain the blood pressure to your target level. And diabetes should be adequately controlled because 2/3 to 75% to 80% of the patients are diabetes. So that diabetes is a very important risk factor. So it should be adequately controlled to prevent the incidence of cardiovascular diseases. Thank you.